characteristics of being a second hardest hit province behind Jakarta, West Java now has managed to bring the number of daily new cases down and is now behind East Java and South Sulawesi. If the trend continues, then maybe other provinces may overtake West Java position in the number of total cases. Our question is, what policies have you implemented that you think other provinces should emulate?
Yeah, thank you, Mbak Susan. First of all, we exercise five approach in West Java. Number one is being proactive. Yeah, we never wait for central government instruction. Whenever we think we must make quick decision, we do. For example, when the PCR test was centralized in Jakarta, the first couple of weeks, West Java already bought a PCR system to South Korea. Second principle is we try to be transparent. Yeah, if we have a good news, we say good news. If we have a bad news, we say bad news, and we deal with whatever situations. Yeah. We created a Picobar apps in order to be transparent because there's so many dimensions. It's very complex. How to register the rapid test, how to apply for volunteers, how to donate the money, and so on and so on. Third principle in West Java is we try to be scientific to all our decision process. I created a series of advisor, epidemiologists, and also economists. So West Java decision is always very scientific and reliable. And the fourth principle is we try to be collaborative. We ask people. This is all. This is our problem, not only the government. So I think we cannot win the war against COVID without the support of everybody. And the last principle, number 5, is we try to be innovative. I'm happy to say we are I think we are the only province that can produce all the equipment against the COVID. We can produce the ventilators, very affordable, now used in many hospitals, from 500 million rupiah down to only 20 million rupiah by PT Dirgantara or PT Pindad. PT Bio Farma can produce a PCR reagent. Unpad ITB produce the second generation of rapid test will be coming next month. We have abundance of PPE, people protection equipment or hazmat suits. Now we can export to Africa and Europe. And we also have 5 factories producing the surgical mask. So I think in terms of innovation, we have a full capacity. Because we are very scientific, Mbak Susan. The science show us that majority of COVID happened to be in Bodebek area, close to Jakarta, the epicenter, and in the Bandung Raya. So that's why we tried the PSBB or partial lockdown first in Bodebek, second in Bandung Raya, third in the whole province. We're now reaching 220,000 tests. Yeah, we try to reach 300,000 tests. Why 300,000 tests? Is ratio done by South Korea. They have 50 million people like West Java, so they think 0.6 is a good number to map the spread of virus. So using that number, West Java is trying to get 300,000 tests, but now to 120,000. So we are hoping next month we can reach 300,000. Now we harvest the good news. Number one, our RT reproduction, COVID reproduction rate is already under 1 for the last 6 weeks. Number of beds in hospital from 100% capacity now on down only to 29%. Yeah. So I think the doctors and the medical staff is in West Java is they having not so much burden like other provinces because uh, 50% of our positive case is already gone, yeah, and recovered. So I think these statistics show us that West Java, quote unquote, according to WHO standard, is under control, Mbak. Yeah. So we try to keep it that way. 70% now new normal. They can open 90% of the activity except educations. So the epidemiologist told me, Pak Ridwan, you have to be careful. Still aggressive testing while you're opening the economy. So this is why we converted 627 ambulance into COVID test mobile. Yeah. So this is the innovation that we have. This COVID test mobile will do the random sampling, checking people on the street after prayer. Wherever there is a crowd, we will send this mobile test to do the random sampling to make sure we are in control. So I think, given the statistic, we are no longer the second to Jakarta. I think we are number 4, as you mentioned. First
Yeah.
is still Jakarta, second is Java, then South Sulawesi, then West Java, not too far now from the Central Java also. But if you compare our case to the whole population, yeah, because our population is 50 million, uh, we are number 27, Mbak. Yeah, we are number 27 in terms of risk. We define risk as how many cases compared to the whole population. So Jakarta maybe has the highest number, but population is only 10 million. Yeah, but West Java only 2,700 compared to 50 million. So when you do the percentage, we are number 27 out of 34 provinces. So I can claim currently we are under control.
As you mentioned earlier about innovation, could you please elaborate on that side? You have mentioned that some universities and institutions have helped to produce health equipment like PT Pindad, ITB, Unpad. Are there any other institutions that have joined the movement?
I think you have to understand two things why West Java is very good on this one. Number one, 60% of the industry in the whole Indonesia located in West Java. Yeah, so we are the 60% home to the whole industry in Indonesia. Second, we have 800 universities, yeah, private and public. Uh, University of Indonesia in Depok, Institut Pertanian Bogor, ITB, Unpad, and so on and so on. So during the COVID, the gugus tugas, the task force, decided to have a FICON with the whole rector of universities, asked them to help fighting COVID using the resources of knowledge, science that they have in the research center in the universities also, and engaging many strong technological state-owned company or BUMN in West Java. So after we discussed, we found that first technological company like PT Pindad used to be producing military equipment, also can produce what we call the ventilators, yeah. But then PT Dirgantara also the same. The difference product between PT Dirgantara, PT Dirgantara is for regular patient that not so severe. We're using the Fan E. This is the name of the product. PT Dirgantara, ITB, and lots of scientists. The ventilator product by PT Pindad focus on very severe patient who cannot really normal breathing using the pindad product. But now already in many hospitals is the product of PT Dirgantara. I'm very proud to say. Then we went to Biopharma. Biopharma produces vaccine and many uh, pharmaceutical product, and they now produce two important development for COVID. Number one, uh, developing the PCR agent, yeah, uh, then also a potential vaccine with other overseas company. The problem before we have this, but we rely too much on import issues, and it's not reliable. It's like it's too slow. Yeah, it's too slow because we have to wait the import good coming, and the case is already happening. So it's not really up to the situation that we need. Uh, Sometimes we got quota from the central government. Yeah, we need 10,000. They gave us only half. So I think the situation is not really good in fighting COVID. That's why I'm very happy that we can produce almost everything fighting COVID, including the PPE in English, personal protection equipment, because the patient is low. Now the PPE we can export to Belgium and some countries in Africa. Remember when we have a crisis of surgical masks because it's too expensive. Now we have 5 factories also producing wood quality masks. Unpad produce a continuation of COVID-oriented technology. One of the best that will hit the market and will create a very strong uh, position is we can create uh, a small PCR, Mbak. Yeah, a very handy. Now the PCR machine will no longer consider as expensive and difficult, right? So I can produce many. I can send to Puskesmas in every village in whole West Java in the next coming month. So I think then the whole West Java is really well prepared for new COVID situation. And also given the rate of COVID that are very low, I'm confident maybe we can maybe we will have a second wave, but since we are now prepared, according to epidemiologist theory, we might get the second wave, but the curve, the peak of the curve will not as high as the first wave, and we will face also the third wave, fourth wave, but along the time, the curve and the peak will be lower, lower, lower. At the end of the day, we can live with COVID with no worries and economy continue. Hopefully, that will be the scenario of West Java.
Is there any incentive or like subsidy you give to all these companies and also universities? And
Yeah.
will there be some like kind of incentive if any private companies are interested in producing the same thing?
Yes. I think one thing that's very concrete, is we put money around 5 billion rupiah for producing the rapid test. So we call it a rapid test 2.0. Yeah, we invest 5 billion rupiah. So we will get the production as well. We get the name. Yeah. So this is how we also seriously use public money for the sake of the public interest. What's the difference between the rapid test that we are doing today and the rapid test that produced by UNPAD? The rapid test that we are doing today, we call it antibody rapid test. It's only detecting the amount of antibody when the foreign substance coming to your body. Yeah? But it's not necessarily detecting COVID. The UNPAD made is we call it antigen rapid test. The test will track the protein of COVID. It's very accurate compared to the existing rapid test and very affordable, not to mention. The existing rapid test, you have to buy 300,000 per unit per test pack. This one maybe only one third. So After we finish testing the suspected group, then common citizen can buy, can have a checking just for their own use. So in the future, you can buy this COVID test in any pharmacies, for example, but local made. So I think this is a good massive contribution to Indonesia healthcare system coming from West Java team.
You mentioned earlier about second wave and third wave and fourth wave. There was this WHO report published recently. It said that even though West Java has 6.6% positivity rate over the past week period, it is actually the lowest among other provinces in Java, but still it does not meet WHO epidemiological criteria. So our question is why you decided to reopen the economy despite not meet the WHO criteria? Is there any pressure from central government to enter the new
Yeah.
normal?
Before and majority things, COVID is about healthcare crisis. Yeah. But from the where I sit as a leader, we found out that COVID is also about economical crisis. So we are having a very dilemmatic time every day. Uh, whether we continue partial lockdown, but so many people also screaming for help. Yeah. Before COVID, only 25% of my population got subsidy. After COVID, increased to 63%. So you can imagine 2/3 of my people now asking money from the government. If you translate this percentage to number of life, before we subsidy 9 million people, now 38 million people ask for subsidy out of 50 million. Okay, so I think that's the reason economic crisis is also need to be addressed. Second, uh, I don't know about what you call WHO criteria. What I know is if you have RT rate below 1 for the next 14 days, then you can claim your area is in control. So that's what I call WHO criteria. And I talked to many epidemiologists also. They are saying green light when we do the new normal opening economy. That's why we have 5 criteria: black, red, yellow, blue, and green. Yeah, it means black of 5 is very worse. Then red, heavy. Uh, Moderate is blue, and normal more or less is green. Today, we have 70% of West Java uh, region is already in the blue zones, yeah, and only more or less 30% is around yellow zone. So I'm opening majority of the in the blue zones and very limited in the yellow zone, but no longer red or black.
Speaking about reopening, Pak, Kang Emil, how was the evaluation after more than 2 weeks of new normal implementation?
The discipline of my people is only 60% according to latest study. So it means 40% still not very disciplined in wearing masks, keeping distance, and also washing hand. So I have to educate more. We created a series of videos, very funny, small videos with local language just to educate people. Second, we open first the industry and offices. Why? Because according to our economists, those are the economy that are low risk in health issues. So we open the low risk first last week, and this week we open already the second step, which is the high risk economy, trade, malls, yeah, with uh, COVID protocol. And I think next week will be a start of outdoor tourism, yeah, uh, and we advise not yet to open the indoor tourism or like night activity, leisure and tourism, because according to South Korea, second wave coming from the nightclubs, yeah, the nighttime leisure activities. So we copy some of what happened in our overseas to comply to this one. School, we start pesantren first, yeah, Islamic boarding school. Why? Because pesantren usually owned by personal and smaller institution. They start and finish with a different time. They have different curriculum. So if one pesantren open, the others stop. It's not really affecting the whole uh, quality of education. But the school managed by government, uh, we haven't opened yet because we don't have yet the green zone in West Java. So once we have the green zone, today we have 70% blue zone. Hopefully next week, some or two have a green zone. Then we can open the school as soon as possible. So I think that's the evaluation. Uh, the second evaluation, we have an increase of potential case in public market, pasar tradisional. That's why the last 2 weeks we sent the 600 ambulance converted into COVID test, mostly to public market. Yeah, with some issues in Bogor, Pasar Cilengsi, yeah, miscommunication. That's more or less still manageable.
Speaking about reopening economy, how badly the pandemic hit West Java economy, and what measures are being taken to recover it?
So there is a study from Pajajaran universities. If I didn't open the economy, yeah, by the end of 2020, our economic growth will be negative, yeah, and it will be very hard 2021 to bouncing and get back to the normal growth. So that's why we opened the economy uh, in the first week of June. Uh, if you see the slides, if no action taken, we will have a very big problem following the blue line. 2020 will be minus, and rebounding also not too good. Yeah. So the reason we open the economy in the first week of June is to follow the orange line to make sure 2020 we still have some positive growth and increase jumping by 2021, and by the end of several years from now we will go back to normality more or less around 5%. Uh, and this is a good study, Mbak. Only agriculture has some very small correction. So it means agriculture
Mm,
is the economic activity that very uh, strong and also survive the pandemic. Uh, uh, Correction is only 0.9%, but services, manufacturing, they hit big time, minus 4.8%, minus 4.5%. So it's very, very difficult, but agriculture is not. So it means in the future, West Java will focus also back to agriculture, but with 4.0 approach and technology. So hopefully, if in the future we have some interruption or disruption by similar like COVID, I think our economy will stand and survive following this statistic.